Good morning, everyone. Myself, Aniket Bhardwaj. My topic is Therapeutic Good Administration. Contents of the topic or introduction, objectives, role of TGA, organization, registration process, what does it regulate, statutory advisory committee. Introduction. TGA came into effect on 15 February 1991. The Therapeutic Good Administration is a part of the Australian Government Department of Health and Aging, responsible for regulating medicine, medical devices, biologicals, vaccines, sunscreen, vitamin and minerals, medical devices, blood and blood products. The TGA administers the Therapeutic Goods Act 1989, designed to ensure therapeutic goods supplied in Australia meet acceptable standards for quality, safety, and efficacy. Objectives: to enhance the health of the Australian community, to provide a national framework for the regulation of therapeutic goods in Australia, to ensure the quality, safety, and efficacy of medicine, and to ensure the quality, safety, and performance of medical devices. Essentially, therapeutic goods must be entered on the Australian Register for Therapeutic Goods before they can be supplied in Australia. Role of TGA: pre-market evaluation and approval of registered products, development, maintenance and monitoring of the system for listing of medicines, licensing of manufacturers in accordance with international standards of GMPs, post-marketing monitoring through sampling, adverse event reporting, surveillance activities, etc. The assessment of medicine for export. Under the Therapeutic Goods Act 1989, therapeutic goods are defined as product for use in the human in connection with preventing, diagnosing, curing a disease, defect or injury, influencing, inhibiting or modifying a physiological process, testing the susceptibility of a people to a disease, influencing, controlling or preventing conception, testing for pregnancy, replacing or modifying parts of the anatomy. Types of therapeutic goods: medicine and blood products, prescription medicine, over-the-counter medicine, complementary medicine, blood components and plasma derivatives, medical devices, implants, in vitro diagnostic, low-risk medical devices, biologicals, human stem cell, tissue-based products, cell-based products. Australian Register of Therapeutic Goods. All goods must be entered in the ARTG before they can be supplied in, imported to or exported from Australia. Registered medicines. High risk medicine that are registered on the ARTG, evaluated for quality, safety and efficacy. Product information is approved by the TGA. All prescription medicine, most over the counter medicine, some complementary medicines. Listed medicine. Low risk medicine that are listed on the ARTG contain pre-approved low risk ingredients, can only make limited claims and cannot imply that they will be useful in the treatment or preventing of serious illness. Some over-the-counter medicine, most complementary medicines. Medical devices. High risk devices are evaluated for quality, safety and performance. Low risk devices are not evaluated for performance. Devices are classified according to their level of risk, ranging from the class 1 lower risk such as urine collection bottles to class 3 higher risk such as antibiotic borne cements. But TGA regulates medicine prescribed by the doctor or dentist, medicine available in the general pharmacy, medicine available in the supermarkets, complementary medicines such as vitamin, herbals and traditional medicine, medical devices such as bandages, heart pacemaker, etc., vaccine, blood products and other biologics, manufacturing and advertising of these products. Other therapeutic goods regulated by the TGA are in vitro diagnostic medical devices, blood component, plasma derivative, tissue and cellular products, tissue and cell-based derivatives, sterilant and disinfectants. TGA executives. TGA executive has the overall responsibility for the management of the TGA's regulatory function activities. It comprises of TGA National Manager, Principal Medical Advisor, Principal Legal Advisor, Chief Regulatory Officer, Chief Operating Officer. Market authorization group. The level of assessment is based on the how much risk the product poses. Low risk and high risk. Low risk. Products such as complementary medicine and low-risk medical devices are assessed for the quality and safety. High-risk products such as prescription medicine are assessed for the quality, safety, and efficacy. High-risk medical devices are assessed for the quality, safety, and performance. Significant features in the new registration process for prescription medicine. The TGA has come up with the phase-wise registration process and has named the stages as milestones. Each of them follows a separate pathway. The new process aims to enhance the dossier quality. The dossiers are prepared based on a common technical document format and follow all the regulatory requirements. The pre-submission planning phase is important as applicant knows detail of the prospective application. This is done at least 2 or a quarter months before the submission of the complete dossier. These stages help to the TGA come up with the dates of the subsequent milestone and get the resources ready to manage the CDD. The next phase is submission. Once this is done, the TGA does not allow the applicant to offer any additional data or information after the submission date. It is mandatory to submit a complete dossier that is correct and of high quality. Under Section 31 of the Therapeutic Good Act 1989, the TGA requests additional information at the evaluation stage. After the initial evaluation, all the requests are collated and sent to the applicant. This is the process of the registration. Milestone first, pre-submission phase, lodgement of a pre-submission planning from PPF before the first of every month. The PPF is completed and acceptable, so TGA sent a planning letter to the applicant. The PPF is incomplete. The TGA deems the PPF not acceptable. This is the milestone second. Submission phase. Dossier and fees submitted to the TGA before 15th of every month. Application is considered effective and acceptable for evaluation. The TGA send a notification letter that may contain a notice of the evaluation fee payable. Application is considered not effective. This is the milestone third. First round assessment phase. The evaluator considers the data in the dossier. No issue in the dossier. Application goes to the next phase. An issue or a question in the dossier. So TGA send a consolidated at section 31 request to the applicant for information on detail pertaining to the evaluation process. Regulatory support group provides whole of agency regulatory support services to the TGA. This includes legal, finance, information technology, information management, communication, human resources management services. Thank you.
Got